Okay, so this next video is on craniosacral therapy. I'm going to do two different techniques. The first one is direction of energy. So Andy actually has some pain right about here in his back. So I'm going to actually use this technique to treat him today. What you want to do for this type of technique is you want to place your hands on either side of the pain or the tension. So I'm going to do that now. Okay. Now, as I'm doing this, I want to make sure that my shoulders, my elbows, my wrists, my hands, everything are very relaxed, because I don't want to be putting actual pressure into his back. They say that with this technique, you should only be putting about as much pressure as a nickel would be placing against your skin. So it's not very much. So, while my hands are here, I should have Andy imagine any sensation running between my two hands. It might be warmth or a cool sensation, maybe tingling sensation, whatever he wants to think about that would help maybe relieve the tension in this area. And again, I need to remain relaxed the whole time so that I'm not putting pressure through his back. Also, something to think about is my hands should be contoured to his skin so that it's comfortable for him. Okay, so that's it for the direction of energy technique. Next, I'm going to have Andy turn over onto his back for the next technique. So this is called Fascial Diaphragm Release, and it's actually a different technique than the ones that were taught in class over the weekend. This is a different technique that I learned from a chiropractor. What you want to do, like I said, is have the patient lay supine, and then you want to actually grab the patient's ribs, like right at the base on either side. And what I'm checking for right now is any bending in either direction or any twisting in either direction, in case there's some type of imbalance. We're going to pretend that he does have an imbalance and that he's bent and twisted to the right. Okay, so now that I know that that's present, because I could feel the bending and the twisting, that he's off-centered, now I'm going to have him take a deep breath in and then hold his breath. And while he's holding his breath, his body will naturally go into the position that's probably wrong, like I just talked about, the bending and the twisting to the right. And as I feel him bending and twisting to the right, I need to straighten him out so that he's in neutral position to help release the diaphragm. And then whenever he feels like he needs to breathe out, he can. There we go.